Hello and welcome to Courageous Doctors, the news show for you and your doctor. On this show today, we're going to cover Obamacare updates, other interesting healthcare news, and health and safety tips. Now let's begin. Washington Post says that we're into the sixth enrollment for Obamacare, and we don't think the premiums are going to go up too much this year. However, the president has now allowed states to use federal subsidies to buy cheaper plans, and these plans may not have all the safeguard of Obamacare regs. That's why they're cheaper. So we may not have pre-existing conditions. We may not have pregnancy. We may not have a lot of the things that President Obama gave us. And so we'll have to see how that affects the healthcare, because a lot of the younger people buying insurance, of course, are going to want to go with the cheaper care, and they don't have a lot of these conditions. So we'll have to see what happens. The Congressional Quarterly, and this is something we've reported on in the past, the Center for Medicare and Medicaid, they are now allowing the president to put his work requirement on a number of people in a number of states that are doing Medicaid, and a number of states have applied for these waivers. I'll give you some examples: Arkansas, Kansas, Utah, Ohio, Wisconsin, Mississippi, North Carolina, Maine. I mean, the states are applying for it. They're trying to cut down the number of people that are actually using Medicaid. Here's the problem. This work requirement, you have to be under 50, not be married, not be taking care of other people, and then you have to either work or be trained to work. The problem is, if you look at Vox, Vox did a thing on the Brookings report that said that most of these people in these states that are doing no work, having work requirements, most of them are elderly, disabled, they're children. So this doesn't even apply to them. So what's going on? So I don't know. The president wants to have this work requirement with Medicaid. I don't know. I guess he feels it's going to help most of these states. These people those that could work were already working anyway. So I guess we'll have to see what this means. Now, this next point is very disturbing. Congressional Quarterly has been keeping us up to date. The proposed rulemaking where the White House wants to really stop immigration, or what they call illegal immigration. But so, for example, but in this case, it's even legal. So, for example, people that have green cards or are either waiting for green cards, or they even have green cards and they're waiting to be a citizen, if they apply for a government program, they are being asked to leave the country and losing their green cards. What in the world is going on? Almost anybody with any sense is against this. Of course, Trump is in favor of it. He's the one doing it. But this is really terrible. It's estimated that over 1.7 million new immigrants, the children of new immigrants, are going to be without health care. This is really horrible. But, I mean, these people are afraid. I mean, who would put their kid on Medicaid, buy food stamps, CHIP, which is a type of children's insurance where you make too much for Medicaid, welfare, food stamps, that's the SNAP program, any of these things, who's going to do it? I mean, you're going to let your kid die or suffer or be hurt or injured or something, because if your whole family is going to be thrown out of the country, you're not going to go on health care, and then who knows what's going to happen. So I don't understand why the president has to do this, but there's a lot of things I don't understand why he's doing what he's doing with health care. If any of you out there want to throw in your comments, and you're either pro or against what the president is doing, but I, as a pediatrician, sitting here working with a lot of these children, hardworking people, and we're talking about people here who have green cards, and they're afraid of losing their green cards. I mean, these are legal people. And of course, my heart goes out to those people that just come over that haven't gotten legal status. Some of these kids even being born here, and they're not going to be on these programs. I honestly, to be honest with you, have treated a lot of these people for free. I mean, I'm a doctor. What am I supposed to do? But these people are terrified to get any kind of program that's going to help them. And I just think there has to be a better way. I'm sorry for editorializing, but there has to be a better way. Okay, moving on. The New Jersey Earned Sick Leave has started. That's for state employees, whether you're full-time or part-time. It's basically 1 hour of paid sick leave is earned for every 30 hours worked. It comes out to no more than 40 hours a year or 5 working days a year. So this is a great thing. I wish it applied to everybody. We've done shows on this in the past. I worked with them when they first came out. Family Working Union, Family Workers United, and other people. I did shows with them. It's so important because people need to be able to take care of their loved ones, leave work. They need to get full pay, and the pay is regular pay. And they can't be just waiting till late hours to go to an emergency room when they really need to take care of their kids. So it's starting off state employees. I hope it goes for everybody. New York Times says that, the president, this is a very good thing he's doing. He's trying to reduce the price of drugs, which is a major problem. We've reported a lot on this on the past. And he's hoping one way to do it, and this is according to the New York Times, is to allow Medicare to pay the same prices that are in Europe. So this way we'll get cheaper prices. I hope it works. Washington Post, this is disturbing. Apparently healthcare.gov has been breached again. 75,000 people are at risk. We'll see what happens. And lastly, CBC News reports that, and we knew this was coming, CVS and Aetna have merged. And this is very interesting. This is a new era in healthcare where we have to see, you take a company like CVS that has 1,100 healthcare clinics, they buy an insurance company, or an insurance company buys them, and now what's happening, I assume they're going to both be cheaper for them paying for the drugs because the insurance company owns the pharmacy, so it'll be cheaper to get medicine. They're also going to steer patients towards that. Guys like me in private practice, it's been estimated, we've said in the past here on this show, that anywhere from 13 to 18% of our visits are decreased nationwide in medical homes where you have private doctors like myself that know you, love you, take care of you. So we have to see if the new medicine is going to be insurance companies and pharmaceuticals buying each other up and having these massive clinics where nobody really knows you or cares about you. And we'll have to see what happens to the rest of us. We'll just follow it. And, it's the way it's going to be, so we have to live with it.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Waxed-In is a full-body unisex studio. We specialize in hard wax, which is gentler on the skin. We do all types of waxing from head to toe. You can come in with your friends, so you have the moral support. We have hors d'oeuvres. You do have to have a minimum of 8 people for that party, and you would schedule that. Everybody's looking for a hand to hold and then someone to share the experience with, so you can look that up on our website. We have prenatal waxing. We take a little bit more time with the new moms, and a lot of people will schedule that once they hit their second trimester. We do have a waxing membership. It's set up just like a gym membership. It's for Brazilians. It's $45 a month, and you come in just like you would go to the gym. It comes out automatically, and you just show up for your wax. We have several memberships for different services. We also have wax packages. The phone number is 973 542-8442. The website is www.thewaxden.com. We have 24-hour online booking.
Come to the Wax Den. We wax it all.
All right, let's move on to other healthcare news. USA Today, the CDC is still looking for the cause of the polio-like virus going through the country. Hundreds of kids have been paralyzed. It's not polio. It's probably one of the summer flus, the enterovirus we call Coxsackie or echo. You know, the hand, foot, mouth with the blisters and high fevers and all. Most children that get this do not get paralyzed, but hundreds have. It's been going on for a number of years. Apparently, some of the types of this virus have mutated to the form that can cause polio or polio-like illness. It's called acute flaccid myelitis, AFM. So maybe one day we'll have a vaccine for it. But this is our common summertime flu, and it's just caused some problems. Measles is in New Jersey and New York now. It was brought in from somebody doing foreign travel. So we've been alerted by the Departments of Health that if you haven't been vaccinated, please do it. I know in Lakewood, where there's been a major outbreak, and in Muncie, New York, and in Lakewood, I know New Jersey 12 reported last night on the news I caught that you're being vaccinated. These vaccine clinics are opening up. And the State Department of Health also reported that even children under 1 who are too young to get the vaccine are being vaccinated early, and they will be revaccinated after they're 1 year old. So this outbreak, we're all on the lookout for it. I've been doing blood work for measles on a number of suspicious rashes, and they've all been normal. They've been other kinds of viruses. But I think if we just follow the basic vaccine routine that we've been doing and be careful about it, we'll probably be okay. Let's get to recalls. Food poisonings, terrible. Salmonella in beef. It has a EST label of 267. So any beef with an EST label of 267. It was sold in Walmart, Cedar River Farms, natural beef. Listeria is in ready-to-eat ham, and that was Johnston County ham or boneless deli ham, Old Dominion. Salads have salmonella and listeria, and those are from Trader Joe's and Whole Foods. Now, it doesn't mean they're all bad. What I'm telling you is when you go to these places, ask if this is one of the recalled foods. U.S. Department of Agricultural and Food Safety has asked these following foods to be recalled: GHSE, Market Side Festa Salad and Steak, Mary's Harvest Fresh Salad, Mary's Harvest Fresh Foods, GH Foods California, and Prime Deli. So just check with your store and see if it's been recalled. We don't know the source for a lot of salmonella in chicken, so we don't really have a specific recall, but hundreds of people have been sick in over 29 states. Salmonella in eggs from Gravel Ridge Farms. And I don't know if you've been following this recently, Duncan Hines had a major recall also. Not all Duncan Hines, but the cake mix. So just check at your stores and see if anything's been recalled. The CDC tells us that 80,000 Americans died last year of the flu, and they think it's going to be worse this year. I'll tell you why I think they're right. That's pretty scary, but I'm in pre-flu seasons, and I got to tell you, I'm busy. And I got to tell you that these people are sick. Thick mucus, coughs that last for a month, choking, nobody sleeping, kids, parents, a lot of bronchitis, horrible croup, blistering rashes. these are strong infections, and I think it's going to be a bad year. So, we should all get our flu shots, and I think that's right. There's also a new one-day flu medicine. I haven't seen it. It was made in Japan. We reported it last year. You only take it for one day. Right now, I'm still using Tamiflu. We'll see if this new one comes out. Okay, Star Ledger says that Legionnaires is still here. I live in West Orange, and the West Orange schools have it in their water system, and they had to be filtered and cleaned out. There's a Ramada Plaza Hotel near Newark Airport. It had to be cleaned out. So nobody is really free 100% of this Legionnaires. It can be in any water distribution system, and we just have to be careful and keep all our water systems clean. Star Ledger says that 2 deaths from West Nile, so tragic, in Bergen County, and we're seeing the highest number of West Nile cases reported since 2012. Star Ledger says Lyme disease, there's a new tick carrier. Now, this is very interesting. Only 70%, only 3 out of 4 are going to actually get the rash. You think if you're bit by a tick and you have this rash that looks like a ringworm and gets bigger and bigger and bigger, but 1 out of 4 doesn't get that. Also, we say, well, go get a blood test. If you get the blood test too early, it doesn't show. I always tell people just treat, which the CDC agrees with me now. I've been doing it for years. Just treat, and if you're suspicious that you had a tick bite and you felt sick or you had this rash, and then 4 weeks later, get the blood work. If it was negative, you either overtreated, but at least you don't get Lyme. Okay, let's see. Department of Health in New Jersey says that we had 142 cases of rabies this year. Of course, bats are always the worst. Skunks, raccoons, fox, groundhogs. But here's something you didn't realize. Cats. There's always a certain number of cats each year that have rabies. I did not know that. USA Today just warns us that syphilis is on the rise, so more babies are being born with syphilis. It's important for me as a pediatrician to know that. CNN says the HPV vaccine, this was interesting. They now, it used to stop at 26. You can now get it up to 45. So more, I'm unfortunately too old to get it. I would have gotten it. Of course, my children got it. You don't want to get that. HPV will definitely cut down cancers. You should get the shot. It'll cut down the cervical cancer, mainly in women, throat cancer in men. Those are the big ones that it cuts down. All right, this is always scary. I've reported these cases time to time, and they just, make you shudder. The brain-eating amoeba kills another man in a Texas water park. Gets in your nose, goes to your brain. I just had a patient today. A whole family had cryptosporidium, which they got from pools. Cyclospora you can get from pools. These are like parasites like amoeba. Very bad. Okay, we talked about before the Coxsackie and enterovirus, which in some children summer flu can cause a polio-like virus. You've probably all been following the story from Wanacue in Passaic County and from Voorhees down south, where a handful of children have died of this bad adeno. Adenovirus is a bad flu, a very, very bad flu. It always is. I've had it myself 3 times, and you just feel like you're not even there. I mean, it just wipes you out like a flu. And these children were, of course, compromised. And, like I just mentioned, 80,000 people died last year of the flu. Who's going to die? Some healthy people, but a lot of them that die are compromised, very young, older, debilitating diseases. Well, adenovirus is a kind of flu. So who's it going to kill? Kids in nursing homes, on vents, or debilitated. And it's very scary. Okay, let's see. NBC News. Here's something you don't hear every day. Typhus is in L.A. Who would have thought typhus? That's something you travel around the world and to some far district region in some Amazon or something. But no, we got typhus in Los Angeles. Typhus is one of those tick diseases. gives you a rash, a flu-like illness. I just didn't think we had it here. Oh, this is scary. CNN reports that rubella is now in Japan. I haven't seen rubella in 30 years. That's German measles. It's in Japan. Who would have thought? Washington Times, on a positive note, says more of our hospitals in the United States are prepared to fight the Ebola epidemic. You'll all remember, some years back when Ebola was brought to this country by workers who were working in Africa. And Ebola's back in Africa again, by the way. But the workers came over here, brought the Ebola here, and we had to figure out a way to safely get these people to hospitals. Some of our nurses taking care of these patients caught it here. It was just horrible. All right, let's move on to health and safety tips. We start with Science Magazine, and they said that the SNAP, we mentioned SNAP before, the food, that's like food stamps. They're giving incentives in place where you actually get more food if you buy healthier food. So that was kind of interesting. There's been a new rule-making law that food labels in the future will say if you have sesame seeds in it because of that woman that died of a sesame seed allergy, any kind of, there's always nuts, are always on there, nuts, eggs, milk, but now they're going to add sesame. Let's see. This is interesting. Popular Science, I thought this was really interesting. Our food labels are going to change. So listen to this, people. Listen to this. This is really interesting. We're now going to report the actual food serving you actually eat. Did you ever go crazy? Like you're looking at these labels and it's like, what are they talking about? Who eats one potato chip or one Oreo cookie? I mean, what are these foods? You have no idea what you're really eating. They figured out a way to report what you're actually eating. And listen to this. Like, for example, who's going to drink half a Coke? You can drink the whole Coke. Okay. They're going to mention added sugars and not just total sugar because you have sugar that's naturally in the food you're eating. And that's a very small part of it. Most of the sugar you're eating is sugar added. And now they're going to actually say, because if you get a total sugar and you think, that's not that bad, it's part of the natural sugar, part of the food, it's not going to give me high sugar peaks and insulin drives and make me hungry, it's going to be just natural sugar. No, a lot of that might be added. Now they have to say this is added sugar. They're going to list calcium and iron and vitamin D and vitamin K. I've reported many times that a lot of us don't take enough potassium. Not vitamin K. I'm sorry. Potassium. Potassium is abbreviated K. A lot of us don't eat enough potassium. You should eat about 4.5 grams. Most of us eat less than that. We should have less than 2 grams of sodium, more than 4.5 grams of potassium. Bananas, avocados. Most of us are very short of that. Now they're going to actually put potassium on the label along with sodium and calcium and iron, vitamin D. These are all important. They're going to drop vitamin A and vitamin C from the label. I don't know why. They're going to drop it, I guess, to save space. Now, one last thing about labels, because I think labels are really something we're all excited about. They're no longer going to list total fat. It's crazy. You're not going to see total fat on a label. You're going to see the type of fat, and you decide if you want to eat that type of fat, like trans fat, which is bad, saturated fat. But so this is interesting. We'll see how it works out. I don't know when this takes effect, but it'll be pretty soon. All right, let's move on. CNN says that there's weed killer in our cereals and snack bars. Honey Nut Cheerios, Quaker Supply granola oats. Well, according to the environmental working group, they found all this weed killer, but the Environmental Protection Agency says it's still safe limits. See, here's the problem. Here's the problem, you guys. You're growing food in a field that, like baby rice cereal, there's arsenic in the ground. It's part of the fertilizer. There's going to be pesticides. There's going to be things to kill weeds, herbicides. So some of this stuff is going to naturally get into our food. You would hope food being used for children would have less of it. According to the EPA, it's still a safe level, but these environmental groups that don't want anything in anything, of course, are going to find this stuff. So I guess we shouldn't be grossed out that we have some of these poisons in our food, as long as it's at levels that we're told are safe. Okay, let's see. CNN says the FDA has removed 7 additives that can cause cancer, food additives. Benzophenone, ethyl acrylate, methyl eugenol, myrcene, pulegone, and pyridine. They were found in candy, ice cream, gum, baked goods, and drinks, and they're not there anymore. Okay, Washington Post says the FDA is now warning that some of our dietary supplements are contaminated. These are weight loss supplements, muscle growth supplements, supplements for sexual enhancement. This was reported in JAMA's Network Open. JAMA is Journal of American Medical Association. I get that journal. They're reporting that some of these supplements have been contaminated. And this was reported out of the California Department of Health. Things like dapaxetine, which is found in antidepressants, was made its way into some of the supplements. So why an antidepressant is into my weight loss supplement, I don't know. Sibutramine was supposed to be banned. I've actually seen that myself, and it's pretty scary. I know people that come to me and say, "Give me sibutramine," and I'm trying to tell them it's going to destroy your liver. It's banned. Get out of here. What are you talking about? And they still ask for it. I don't give it. They ask for it. Ephedrine was banned. Ephedrine is like an adrenaline. I don't know if you remember years ago, people dropped dead on basketball courts taking too much of this ephedrine. It's banned. Anabolic steroids. So California's Department of Health found, I guess they did a study in California, and they found it in these supplements. Again, weight loss, muscle growth, sexual enhancement. If you're using these supplements, please look carefully. Make sure there's no dapaxetine, sibutramine, or ephedrine or anabolic steroids. Okay, let's see. NBC News says the FDA is banning lead from hair products. What the hell? Excuse me. What is lead doing in my hair products? I know if you want to test to see if somebody's been poisoned with a heavy metal, you can test their hair because it will come from the body out into the hair, and that's one way some of my friends in poison control can actually look for it. But why is it being put in my hair? Horrible. So anyway, it's banned. I don't know how long it's going to be there. I should probably ask my hairdresser, they got me ready for the show today, if she has lead in the products she put on my hair, but hopefully it's not there. The Ledger, Star Ledger in New Jersey, says that water in Newark has a very high chlorine content with chlorine byproducts. And of course, we all know about the lead in the Newark water. That was horrible. I did not know this, that the water in Newark goes to surrounding towns. I work in some of these surrounding towns, like Bloomfield, Nutley, Belleville, East Orange, South Orange, Liberty Township, Brereton, Pequannock. The mayors of these towns say their water level is safe, and whatever was coming out of Newark with these chlorine being too high and its byproducts, it's still safe, so not really sure. Popular Science. Children are burned by hot soup heated in plastic or styrofoam. That's no good. Cooking Light. Oh, this is interesting. Let's get to some fun stuff. Cooking Light says that our iron intake should be 8 milligrams for men, 18 milligrams for women of 19 to 50, 27 milligrams if you're pregnant. And in addition to the usual foods like meats and chopped liver, which I still eat and all, they said, and I did not know this, dark chocolate has iron. White beans have iron. Tofu, spinach, lentils, and all have iron, which are all fun foods. They suggest take it with vitamin C. You'll get better absorption. Let's do some more fun stuff with foods. NBC News says minerals and vitamins are in good foods that we eat. You can get minerals and vitamins naturally in beans, berries, meats, citrus, dark chocolate, vegetables, and shellfish. And shellfish has a lot of zinc. Zinc is very, very good for preventing diarrhea, healing our gut, for hair growth, like zinc in your shampoo. Zinc helps us fight infection. I did a research once with on zinc in kidney patients. Zinc is very good for us. Okay, let's see what else. Spinach has vitamin A and C. Sweet potatoes have vitamin A and C, manganese, potassium, and vitamin B. Yogurt has vitamin D. Nuts and seeds have vitamin A, C, and E. Red peppers, vitamin C. So that's fun. Let's do one more fun thing before we close. Food Network debunks myths. Myths about food. You can only eat fruit in the morning. Not true. Just be careful because fruit has a lot of sugar and you want to make sure it's a sugar that's naturally mixed with fiber so you don't get a high sugar high and it doesn't sit on you because you're exercising all day. So just be careful. Eating carbs at night will make you gain weight. Nope. Food Network says it depends on the type of carb. Not all carbs will do that. Skipping meals will burn fat. They said you'd have to skip a lot of meals to burn fat. Better to eat sensibly, keep your body working. Unless you're going to starve yourself for a few days, that's not going to work. Bananas having too much sugar. They say, oh, really? 12 grams in a banana, compare that to 63 grams in a chocolate bar. Juicing is a healthy way to diet. They said, no, juicing only has carbs. So this brings us to the conclusion of another show. We look forward to hearing your comments. It's always a pleasure to be with you, and we'll share those comments with you next time. Enjoy and have a very happy Thanksgiving, and we'll see you next time.